recording. So what we're going to do is we are recording this news briefing, and then we will send a link out to reporters afterward. So apologies for that. And let me just run through again, reminder on how you ask questions. So you can ask questions during today's media availability through the chat feature in Zoom. If you're a member of the media and you've joined us by phone, please switch to the web app by using the link provided in the news release. At this time, we will not be able to take questions via the phone line. You will have to rename yourself, and just a quick reminder on how you do that. Click on the participant button at the bottom of your screen. A box will appear on the right-hand side of the screen. Click on More, then on Rename. Type your name and your media affiliation in the pop-up box. And if you want to ask a question, just simply click on the chat button at the bottom of your screen. A chat box will open on the right-hand side of the screen. Select my name, Rob Cowie. Let me know you want to ask a question and get in the question line. We are starting a few minutes later, so we'll go a little bit past 3. Apologize for the late start and going a little bit over, but we want to make sure we give you time to ask your questions. Without further ado, let's get started. We'll begin with Dr. Dean Sidelinger, our State Health Officer. Dr. Sidelinger, let me turn it over to you.
Thank you, Rob, and thank you everyone for joining us today. As you know, the federal and Western states have announced recommendations that children 5 to 11-year-olds be vaccinated against COVID-19 with the Pfizer-BioNTech pediatric vaccine. On Friday of last week, the U.S. Drug Administration authorized the use of the vaccine for children in this age group, and the CDC affirmed that decision yesterday. The Western States Work Group reviewed and affirmed the process and the federal decisions and released a statement this morning. We estimate that there are approximately 330,000 vaccine-eligible 5 to 11-year-olds here in Oregon. This is great news for all of Oregonians because it gives even more Oregonians the chance to protect themselves and their loved ones from COVID-19. More of us now have access to the vaccine, and as we know, the vaccine is saving lives. Let's touch on safety and efficacy. We know that vaccination, along with other preventive measures, can protect children from COVID-19 using the safe and effective vaccines already recommended for use in adolescents and adults in the United States and across the world. Similar to what was seen in adult vaccine trials, vaccination was nearly 91% effective in preventing COVID-19 amongst children 5 to 11 years old. With today's review by leading health experts, Oregon parents and children can be confident in the safety and effectiveness of the Pfizer-BioNTech vaccine for their children. We encourage every eligible Oregonian to get vaccinated if they have not already done so. Contact your healthcare provider if you have questions. Getting vaccinated is the surest path towards putting this pandemic behind us once and for all. Now, I want to hand things over to Senior Health Advisor, Dr. Kristen Dillon, with the Oregon Health Authority's COVID Response and Recovery Unit, who has more information on implementation of the vaccines in children. Dr. Dillon?
Thank you, Dr. Sidelinger. As a family physician, I share your enthusiasm about this great news for Oregon's children. There's significantly more vaccine available for the 5 to 11 population than there was for the adult population earlier this year, and we don't expect to experience the same degree of scarcity. That said, the quantities available are limited, and we're carefully managing how we allocate the vaccines across providers, populations, and geography. We think it's likely that supply will keep up with demand, and if it doesn't, that it should come back into alignment within the coming weeks. Our distribution of vaccine is based on provider requests, organization type, and regional needs. And the doses that Oregon has coming in as an initial supply are anticipated to meet our needs for 4 to 6 weeks. We've been informed that we have access to tens of thousands of additional doses on a routine weekly distribution cadence starting next Tuesday. Do we expect there to be enough doses to meet demand in certain areas, such as the Portland area? The answer is yes. As vaccinations start up, we'll learn more about the need in each region and use the additional vaccine that comes available each week to address any gaps, replenish supplies, and send vaccine to new providers that are getting started. Now, as far as locations offering the shots to 5 to 11-year-olds here in Oregon, more than 350 pharmacies, public health clinics, primary care clinics, community health centers, hospitals, and school-based health centers have been or will be receiving their initial supply of vaccine through the end of next week. As with the introduction of any new eligible group for vaccination, we expect our healthcare system will not be able to accommodate all children who'd like to get vaccinated in the first few days that they become eligible. Families will be able to find appointments or drop-in services in the coming weeks if they're flexible and check with their primary care provider, nearby pharmacies, and other sources. Many providers and local public health authorities are planning to provide special services such as drive-through vaccination, on-site vaccination at schools, community events, and even making pediatric vaccine available at some high-volume vaccination sites. Those we expect to be opening, or in some cases reopening, in the coming weeks. To find those other options, we recommend checking the Get Vaccinated Oregon website, which will be updated to accommodate pediatric Pfizer within the coming days. And there folks can find nearby vaccination opportunities and also register to get announcements as events near them are added. Finally, we know it's natural to have questions about vaccinating your child. The FDA Advisory Committee found that the benefits of vaccination against COVID-19 far outweigh any risk. We encourage parents and caregivers to talk with their healthcare provider so they can make an informed decision. Rob, we're ready for questions.
Thank you, Kristen. So the first question is from Alma at KGW. When can parents expect the vaccine to be approved for kids younger than 5? How will this rollout differ from other age groups? Will more doses be sent to pediatricians? And what do you say to parents who are still hesitant?
Thank you for that question. Studies are currently ongoing with multiple vaccines for children under 5, children in the 6 months to 5-year-old range. We expect results of those trials likely towards the end of this year, or more likely the beginning of next year. And then that will start the process of independent reviews by the FDA's independent review committee to assess that data, to make a recommendation to the FDA, by the CDC's independent review committee to make recommendations to the CDC, and then review by the Western States meeting. So it'll be some time before we have vaccines available for those under 5. But let's focus on the positive news that we now have children 5 to 11-year-olds eligible for vaccine, with over 300,000 people in Oregon newly eligible. And those people can get protected, can protect themselves, their families, and those around them from COVID-19, its serious impacts, and the worst possible outcome, death from COVID-19.
Thanks, Dean. And I'll just add that we are certainly doing everything we can to be ready for younger children to come to be authorized. For instance, as we're developing new high volume sites, we're ensuring that they have settings and design that works well for younger children, knowing that while maybe a 10-year-old could get vaccinated in a setting very similar to adults, the more we're able to build settings that meet the need of younger and younger children, the better prepared we'll be as additional age groups become eligible.
Okay, next question. So I'll direct questions to folks who are in the queue. If you have a question you want me to read, I can do that. But it looks like Savannah can unmute you and you can ask your questions directly. So let me go to Aimee Green at the Oregonian.
Hi, thanks for taking my questions. I'm curious if you know of any vaccinations of this 5 to 11-year-old age group that are starting today. I haven't found any. The earliest maybe this weekend. Can you describe what you know and how fast these vaccinations are starting up?
Thanks for that question. The speed of the authorization and the fact that the vaccine is arriving in the state still means that I think many sites are still getting organized and not wanting to make commitments until they're sure they have their supplies in hand. I'm hearing anecdotally about some providers getting ready to start up this weekend, but I'm not aware of any yet who've done administrations today. I'm sure we'll see some in our data in the coming days.
Just a quick follow-up to that. The timing of this, it seems to me that if people don't get their first shots, I mean, I saw some appointments November 13th, some November 20th. I mean, we're talking about some kids not being fully vaccinated until after winter break starts, maybe even after Christmas Day, right? And what is that? Just unfortunate timing, or what would you say to that? That kids may be traveling or meeting with extended family members without being fully vaxxed?
Thank you. I'll kind of follow up, Dr. Dillon. I think, with this vaccine, there was a lot of pre-planning trying to get vaccine to states and to providers. But knowing that we had independent reviews this week from the Advisory Committee on Immunization Practices for the CDC, we anticipated that they would review the data and come to the same conclusions as the FDA did, that this vaccine is safe and effective. But we didn't want to kind of presuppose that. And then those recommendations go to the CDC director, who agreed to our Western states colleagues who reviewed not just the recommendations, but was the system followed to make sure that these vaccines followed the same review process, that the safety and the efficacy was determined. So I think most providers didn't want to get ahead of that system, didn't want to necessarily schedule appointments for Wednesday morning today and then need to cancel them. So most are taking some time to make sure that those recommendations were in place, that those supplies, which were not available a week ago, as Dr. Dillon said, but are available now, were in place so that they could schedule and get children vaccinated as soon as possible. Yes, this is a 2-dose series with 3 weeks in between, and you don't get full protection until 2 weeks after. But I, hope that we will see a significant number of children get vaccinated in the coming week, and as supplies become more abundant here in Oregon and across other states, because we're not in this alone, that more and more people will have access to vaccines. Would all of us have liked this vaccine to come, a few weeks ago so everyone could be fully vaccinated for the holidays? Yes. Would I have liked it to have come this summer so people could be fully vaccinated before they started school? Yes. But the fact is, we needed to assess safety and efficacy, and this vaccine is very safe. This vaccine works very well at preventing disease, and now we have an additional tool available to folks. Many will have protection as we move into the holidays, but many more will have protection in the new year and throughout the rest of the school year.
Thank you.
Next question is from Amelia Temple at OPB.
Yeah, thank you. I wanted to hear what the state's strategy is for pushing the vaccine out to outside of the Tri-County area to rural communities that have had high COVID-19 infection rates and low vaccination rates.
Thanks for that question, Amelia. As far as our process, we do have over 1,000 providers now registered as COVID vaccinators in the state. We have relationships with them, in many cases, even pediatric practices because of the 12 to 17 work they've been doing. So we put out the offer to all of those sites to let us know what they think they can do in the next 3 months in terms of administering vaccine. Used that to allocate vaccine, and we're able to send orders, we're able to allocate that vaccine and have sites order it all across the state. And then we actually did do a look back at any regions where we felt like maybe the orders were relatively low compared to population, and did a targeted outreach to talk to sites, help providers know what each other was doing so that we could have a good supply everywhere when this starts up.
I'll just add to that operational piece, so getting vaccines to locations and storage is not the same issues that it was with the rollout of adult vaccines, where vaccine was much more scarce. And there was more, the initial vaccines were really required to be kept in ultra cold storage. We have great recommendations that these vaccines can be kept in a refrigerator for immunizations in providers' offices and clinics and pharmacies, can be kept over time. And so some of those operational and logistical pieces for our rural communities, are much less so with this rollout. The issue of vaccine hesitancy and questions about vaccine safety and vaccine efficacy continue. And we think that with younger children eligible, parents are going to have even more questions than they had about their own vaccines. I encourage people to seek out reputable sites based on the data that report on what we saw in the studies, what we've seen with the rollout of vaccines so far. The Centers for Disease Control and Prevention, the Safe and Strong Oregon website have excellent information. The Vaccine Education Center at the Children's Hospital of Philadelphia also has information. If you can't get your questions answered there, write them down, ask your provider with your next visit, because we want parents to be assured that, no steps were cut in having this vaccine authorized for use in younger children. These vaccines are safe. We will continue to monitor the safety of these vaccines as we have vaccines for older adolescents and adults. We will continue to monitor the efficacy, how well these vaccines work. And as we know from the vaccine in older adolescents and children, these vaccines remain very effective. Yes, we need a booster dose over time, particularly for those who are most vulnerable to complications, but these are incredibly safe and effective vaccines. And everyone who has questions needs to get those questions answered, and asking your provider is a good way to do that, to try and combat some of this hesitancy, combat some of the myths that are out there about these vaccines, because there are many.
Next question is from Brian Anslinger at K2.
Yeah, thank you very much for holding this today. So my question is, many parents are concerned about the COVID vaccine affecting their kids' future fertility. Can you please respond to those concerns? Thank you very much.
Thank you. There's no evidence to show that the Pfizer-BioNTech vaccines or any of the current COVID-19 authorized or approved vaccines have any impact on fertility. A little word about how these Pfizer-BioNTech vaccines work. They're what we call a messenger RNA vaccine. A messenger RNA is a small segment of protein that, when presented to the body, tells the body how to make a protein. Those proteins are on the surface of the virus, and then the immune system can respond to those proteins and fight them off and prevent, so that the next time that protein is presented to the person can fight off that infection without getting sick. This vaccine does not go into the nucleus of cells, does not attach or interfere at all with the DNA of the cells. This vaccine merely allows the body to produce a protein. The body responds to it, and then that protein, that messenger RNA are destroyed. So there's not a plausible kind of scientific basis for why it would affect fertility. In addition to that, there have been hundreds of millions of these vaccines given, many to women of childbearing age. And we've seen no impact on fertility rate, no impact on pregnancies. And in fact, women who are pregnant are much more likely to have complications from COVID. So we encourage them all to get vaccinated. So I can say with great certainty that these vaccines do not affect fertility. These vaccines will not affect future fertility in children who receive them.
Okay, next question is from Lisa Balick at Coin.
Okay. Yeah, thanks. After the initial rush, how will you work to get more vaccinated, since surveys show most parents will not be getting younger children vaccinated?
I will start and then see if Dr. Dillon has anything to add. As a pediatrician and Dr. Dillon as a family practitioner, giving vaccines to our patients is bread and butter to what we do in the office. So we anticipate that, unlike the adult vaccines, as the surveys show, parents trust their own provider. Parents want to go to the doctor or clinic where they got their shots. That's their first choice. These locations are very familiar with getting vaccines. As Dr. Dillon said, over 1,000 have signed up to give vaccines. So we anticipate that after this initial rush, that's where the vast majority of vaccines will be given, where you take your child to get care, where you take your child to get a checkup. They'll also be available in pharmacies throughout those communities, some specialized clinics for younger kids, some associated with schools, some other vaccination sites that will vaccinate people across the ages. So we'll continue to make sure that vaccines are offered in multiple settings, that folks who don't have a medical provider who they consider their primary care provider, can we try to link them up with their primary care provider or direct them to another site where they can get a vaccine? That we want to make sure that people get their questions answered, that parents get their questions answered, that kids get their questions answered about this vaccine. And talking to your provider, talking to the pharmacist is a great way to get that information. So we anticipate that, yes, this vaccine distribution, while looking very similar to adult vaccines with it being available in multiple sites, the primary driver of pediatric vaccination in this younger age group will be those primary care providers who've been on the front lines of protecting their patients from COVID-19 throughout this pandemic. And this is another tool, and I think most of them are extremely excited to have it. Dr. Dillon, do you have anything to add?
Thank you. I think the one thing I'd add is what we're seeing from polling. For instance, the Kaiser Family Foundation has done a great job of tracking this over time, is about a third of parents are eager to have their children vaccinated right away, they say. About a third of parents are saying they're going to wait and see. And then there are a decent proportion of people who do have a lot of concerns and questions they want to get answered. So in terms of our response, we certainly don't want to underestimate the demand. We have worked very hard to create a situation where 2/3 of Oregon's children aged 5 to 11 could access vaccine in the coming months, if that's the decision that their parents and caregivers make for them. And then we continue the work like we've done with other groups of Oregonians, just to continue to connect people with trusted sources of information, get their questions answered, and help them make decisions about getting vaccinated.
Okay, our next question is from Angelina Dixon at KVAL. Angelina? If you're having technical difficulties, you can also just put your question in the chat.
I think we do have.
Oh, sorry. Actually, I take that back. Yes, we do. Yes, my bad. So Angelina asks, what are the recommendations for children? Are they able to get the vaccine today or go back to school tomorrow? Or does it depend on the severity of symptoms?
Thank you for that question. As we stated earlier, we are hearing some stories of people being able to get vaccine today, but we know the vast majority will start tomorrow and over the weekend as they get supplies in place, have protocols in place to vaccinate younger children. As with adults, the side effects that we've seen with younger children have been mostly mild. Some pain, possible redness at the injection site, an even smaller number of people who may have felt fatigued or tired afterwards. This was a little more prominent after the second dose. So I would say that most kids could expect to go back to school after their vaccination and are not going to be feeling sick enough to have to miss school. In a small number of kids, they may have such a sore arm or maybe feeling fatigued or tired after their vaccine that they may want to stay home. But that'll likely be an even smaller number than was seen in adults. Side effects were extremely rare in this population in the studies that were done. We know that this vaccine uses a smaller dose of medicine than were in the adolescent and adult formulations. One of the main reasons is to prevent increased side effects in this age group. So I would anticipate that most parents could plan on their child receiving a vaccine and attending school the next day. But as always, as parents of children, we have to be prepared for if our child gets sick and we need to stay home with them to make those arrangements. But it should be rare for a child to have side effects that would keep them out of school following their vaccination.
Next question is from Elizabeth Hayes of the Portland Business Journal.
Her question was just answered.
Thank you.
Okay.
We anticipated that.
Let's give you word saying on top of the chat better than I am. Okay. Do we have anyone else? Oh, Amelia Templeton has an additional question. Amelia.
Yeah. I just wanted to ask about the sort of larger volume vaccination sites that are being planned. I know there was one for Hillsborough. Let's see, what Tektronix. I'm spacing on all three of them, but was wondering if there's any update on those three sites and if the Clackamas site has been pinned down.
Yeah, thanks for that question. The Clackamas site is still in process in terms of identifying the optimal site, particularly given that we want all of these sites to operate, especially in the afternoon into the late evening and also on the weekends, so that it can be extremely convenient for families to access them, as well as people needing booster shots, which these will also offer. And then there is a site in East County, Gresham area, and a site in Hillsborough, Beaverton. And in each case, the planning timelines has them potentially starting up next week. We're sorting out things like contracting with the property owners and some other details to get them going. But they'll be up and running. They'll be up and running soon.
And are those sites the state will be supplying the vaccines to through the allocation that you guys have received, or are the count is who's on deck to provide the vaccines? And I guess just one other, the vision here is basically that a family could come and the whole family could be served at this site, whether somebody needed a booster, somebody needed their first dose, or a kid was getting vaccinated.
Thank you. Yeah, that's certainly one thing we heard as we talked to some of the communities in Oregon that maybe access vaccination more slowly in adults, as we've talked to immigrant groups or members of various racial and ethnic groups. One of the things we hear is please have your sites be multi-generational as much as possible, so that whoever comes from a household or a family can get their vaccination needs met with that trip and not need to go different places for the different individuals. So within the bounds of safety and operating in a way that is feasible, we're doing everything we can to serve multiple needs from the sites. When you asked about vaccine supply, so the vaccine supply is a bit more straightforward this time. There are some federal doses going to pharmacies. There's a few of our states, federally qualified health centers are accessing federal doses, but most of the doses are coming to the state and we are allocating those. And so that's where the doses for these higher volume sites will be coming from, is from that state allocation.
Okay, and we have time for two more questions. Alma McCarty.
Can you guys hear me?
Yes.
Yes.
Okay. Yeah, my question was just basically, I wrote it in the chat briefly, and this may be obvious, so I apologize. But where can families find out where these mass vaccination sites are in their area?
Yeah, thanks, Alma. The Get Vaccinated Oregon site has been a great tool for us through these later months of our operations. And so we really prioritize, especially having special events like those in the GVO site.
And, the information may not all be there now, but will be updated in the coming days as that information comes in. Check back. If you don't see the information you need, you can check back there, but these larger sites will be on there so that people can make plans for themselves and their broader family members.
And our last question from Sean Hall, the Grants Pass Daily Courier.
Hi, thanks for taking my question. Wondering if mandated vaccinations are in our future for kids.
Thank you for that question. As most people already know, we have several vaccines that are mandated for school entry in Oregon and across most states. These vaccines provide protection to kids while they're at school and while they're home, and to the staff and others who are in schools, and are an effective tool at making sure that people are vaccinated and people are protected in schools. And public instruction is something that's needed and required for students. I don't anticipate anytime soon the COVID-19 vaccines being added to those school vaccine mandates. There's a process here in Oregon that's followed that once vaccines are fully approved, that has gone through with community engagement and stakeholder engagement to determine the risks and benefits of adding vaccines to the school vaccination schedule. This process can take a year or longer to do. And so I would anticipate that as these vaccines continue to be used, the safety and efficacy of these vaccines continue to be shown to be highly safe and very effective. And once they receive full approval, that process may start. But it's not anything that I would anticipate happening for this school year. and would happen at earliest for the next school year. But we'll follow a routine process, do stakeholder engagement on these vaccines so that we can talk about the need to add them to that, but it's not in our near future here in Oregon.
Okay. I want to thank Dr. Sidelinger and Dr. Dillon for being here today and answering your questions. I want to thank all of you for joining us today, and we look forward to holding additional media briefings in the future. Again, apologies for the technical issues with the recording, but we will get a link out as soon as possible to all of you, so you'll have access to this recording. And with that, we will end today's briefing. Thank you again.